So this is the main entrance to the hospital, where when the clients arrive, they will see our receptionist, and then he will take whatever details needs to be taken, and then he will also find out from them what they are coming in for, and then he would come, the person that is the client will then come to the examination room, the triage, and then the details or the vitals will be taken of the patient, and then whatever needs to be done to the patient is done for the patient.
So in the Histopathology Lab, what we do here is we prepare slides for histological purposes. So normally tissues are brought from the necropsy room. They are brought in plastic cassettes. We take them through process of dehydration. After dehydration, we infiltrate with wax. After infiltrating with wax, then we go ahead to the microtome, we cut them, and then finally we are able to get them on the slides. Then we stain. Then we are able to view under the microscope. So we come with the slide, you put it under the microscope. It's able to project whatever we have under the microscope on the screen. Then from there we are able to make diagnosis and then maybe show to the owner of whatever is brought for us to examine. So from here, it can be projected onto the screen.
So this is the necropsy room. Basically what we do here is if there's a case, maybe there's a mortality, an animal dies, and we want to find out what killed the animal so that we can save the other animals in the group or in the farm, or the other animals owned by the owner. So we bring the animal here. So this is the PM table, okay? We put the animal on the PM table and we do what we refer to as post-mortem examination. Basically what it involves is we cut open the animal, we look at all the different organs, and then from the lesion pattern that we find, we'll be able to come up with a tentative diagnosis. So by the time we're done with the post-mortem investigation, these are some of the tools that we use. On the table, we collect samples from the organs, okay? Like here, we have testicles from the donkey that we did the post-mortem here. So we collect samples and fix it in formalin, okay? Because we want to process the samples up to histopathology level so that we can look at it under the microscope.
So this is our isolation unit where we bring dogs that have been diagnosed with conditions that are contagious to other dogs. So we bring those dogs here and then we treat them, and then when they've recovered, we do the necessary procedures or routine therapy, and then we will discharge them appropriately. Then we will also give the owners the appropriate recommendation of how to treat to even handle them after they have even been discharged because for cases like canine parvovirus, even after you've treated them and they've recovered and then they have started eating, they still shed some of the virus in their feces. Okay, so this is our anatomy laboratory where students have the anatomy practicals. So when it is time for their practicals, the cadavers will be brought on the tables and then they will be taken through whatever practical that they are supposed to be taken through. So these rooms over here are wards where we keep hospitalized patients. So we keep them here and then we will treat them so they are fully well, and then we will discharge them when we are done with our therapies. So these are our wards where we keep hospitalized patients. So this is our pet lodge or pet hostel where we keep dogs whose owners want to bring them for lodging. So we have some owners that are usually, sometimes they are not around to be taking care of their pets, or sometimes they travel. So in such instances, when you bring them here, we will treat them, we will take care of them, and we do everything that is necessary to keep the dog healthy. And then when you return from wherever trip or whatever place you are going to, you just come and take your dog back. So this is our pet hostel where we keep dogs, whereby the owner is unavailable to take care of them. This is our pet bathing station where we bath dogs that have been brought in here to be bathed. So if they are brought in here, this is where we bath them. So this is our surgical theater where we perform our surgical operations. So currently there's an ongoing surgical operation, a cesarean section where a dog is being operated on. So this is our surgical theater.